All right, we're all set to go. Hi, everyone. Thank you for joining us today. This is the Health Science Information Session. My name is V, and my co-host is Ray. We're so glad that you all are here. Throughout the session, we will be taking questions in the chat, so please feel free to type in your questions there. Make sure to keep your mic on and video off as this session is being recorded. Now let's get started. First, I'd like to share the agenda. We'll have a short introduction of today's speakers, briefly share our mission at UC Davis Continuing and Professional Education, provide a short background of Socratic Arts, give you a glance into the field of health sciences, do a program overview, go over the career outlook, do a course demo, inform you about the program requirements, go over the course schedules and costs, and the people you can contact with questions, and then open it up for some questions from you all. So Ray, let's learn a little about you first.
Okay, my name is Ray Burris. I have a PhD in computer science from the University of Texas at Austin. My background is actually artificial intelligence research, and I've been a professor at Northwestern University and Carnegie Mellon University. About 6 years ago, I got tired of being in academia, so I left and joined some old friends and colleagues at Socratic Arts. And there is a question, Naria, we will mention forensics. During the program, we are probably going to demo another course, Mystery Case, but be glad to answer any questions you have about the forensics course while we're talking during the info session. That's right, V, on to you.
All right, thank you, Ray. Like I said earlier, my name is V Pereira. I graduated from UC Davis in 2015 and have been working as a program specialist for CPE for the past 3 years. I'm very excited to be working with Socratic Arts and creating these programs for you. As a side note, if you haven't already seen the updates on our website, our immersion programs are continuing to grow. We went from offering 4 courses in the winter to 10 courses for the summer. And I'm very proud that we have been able to work with Socratic Arts to provide even more career options for you to explore. Oh, by the way, we love receiving feedback from our immersion program students at any time, and we are always looking to improve your experience in our courses, so please feel free to email me. Moving on to CPE's mission, Continuing in Professional Education has been the lifelong learning arm of UC Davis, providing learning opportunities that range from youth to international to professional communities. We have served students in Northern California, all 50 states, and more than 100 countries, and we hope to continue our reach in the future. Now I'm going to hand it over back to Ray to tell you about these exciting programs and give you a little background on how it all began.
Okay, great, thanks, V. So you probably haven't heard of Socratic Arts, so let me tell you a little bit about us. The company was founded in 2002 by a visionary computer science and AI professor, Roger Schank. As I said before, my background is also artificial intelligence research. And back in the good old days of AI, we looked at human cognition as a model for building intelligent systems. And one of the most fundamental things that an intelligent entity like a person does is learn. So when we looked at learning, Roger in particular was struck that the way students are taught in school at all levels, from young children to adults in professional education, does not align well with how people naturally think and learn. So you know what school is like, right? A teacher or a professor like me lectures at you. You more or less ignore me. You look at Facebook or Instagram or Twitter or TikTok or whatever you like, and kind of drift in and out. Once in a while, you're given some homework problems that are kind of small, relatively simple problems with definite answers, and you take a test once in a while. Well, cognitive science research unambiguously tells us that method of instruction does not result in gaining knowledge and skills to be used, knowledge and skills that transfer from the learning context to any real application. So how do you do that? Well, what we've done based on our research and the research of others is we have completely rejected this lecture, homework, and test model. And instead, we create a realistic story of professional work. And the student is placed in a professional role, does the same tasks that a professional would do, uh, and learns the knowledge and skills to succeed just in time as they're relevant to what the student is trying to accomplish. So, how do you do that? Well, we have a lot of very carefully curated learning resources available online. And more important than that, we have knowledgeable mentors who are available to give students help, advice, and feedback on their work. So why study health sciences? Well, I mean, it's actually pretty obvious. Employment growth in healthcare is projected to be really high, at least 15%, much faster than other occupations in this country. And that's largely due to an aging population. And the median wage is well above average. So it's actually a good thing for young students to start exploring careers in this area because getting an early start ensures future success in a profession like this. And if you or be students or parents are interested in the possible careers, I mean, there's a huge list and they're available on the Bureau of Labor Statistics website. And of course, you'll get a copy of this presentation, so you don't need to write this down. So the program is 100% online. Students can do the work, they can work through these learn by doing tasks from anywhere. At every step, mentors coach students, they don't lecture, and they evaluate students based on work produced. And we use a mastery-based approach, which means that if we believe that a student could do a little more work and improve their mastery of underlying knowledge and skills, we'll give them a lot of feedback and ask them to do that. The learning experiences that we try to create are realistic. We give students authentic problems to solve, just in the way a professional would solve them. And another nice thing about this learn by doing story-centered approach, we call it, is that we can put a lot of emphasis on skills beyond purely technical skills, helping students to improve their analytical thinking, communication, and problem-solving skills. So as I said, we call this approach the story-centered curriculum approach. We developed this when I was a professor at Carnegie Mellon's Silicon Valley campus. And we've had hundreds, maybe thousands of students go through courses taught this way. And they've been proven to be a very effective way for learning knowledge and skills that transfer from learning to application. And it says workplace here, but I think the skills are equally valuable in a school setting. Again, we put a lot of emphasis on skills beyond purely technical skills. And again, the secret sauce of these programs is the knowledgeable mentors who are always there to provide help, advice, and support students as they learn. So let's talk about the courses. There are a bunch of courses we're going to go through. So the first course is forensic investigation. So the student is put in the role of a medical forensic investigator. A woman has died of a gunshot wound, and the student's task is to determine if it was suicide or if the woman was murdered. After doing a principled investigation and making a determination, the student will prepare testimony to deliver in court in simulation. One thing that's really important to note about this course is there is some graphical content. I mean, it actually deals with a real murder case. We worked with Las Vegas, Nevada medical examiner, and this is actually based on an actual case. So students will see the real things that a forensic investigator would see. So you say, are the faculty staff at Socratic Arts, Helen asked, and the answer is yes, Socratic Arts does provide the faculty. A new course that we're offering, we did offer forensic investigation in the spring already, is internal medicine. And the student is a general medical resident in the hospital's walk-in clinic. And an old guy, he's a Vietnam veteran, comes in complaining of several acute symptoms. And the student's job is to diagnose, treat, and cure that patient. Also, the student is asked to serve on the medical center's ethics committee because there are a lot of difficult issues surrounding the ethics of certain treatments. Medical mystery case is another, probably our most popular case when we ran it in the spring. And again, the student's a resident working under the supervision of a fictional attending physician. And a young patient comes in with mysterious symptoms, which might or may not be serious. They are certainly unusual for a young child. And the student's job is to diagnose and recommend a treatment for that patient. You can tell we're going through several of these health sciences courses, so I'm going to go through them fairly quickly. Another new course is nutrition advisor, and the student is playing the role of a dietitian at a fictional health clinic. What they will do is they will review client cases that were handled by other dietitians and make recommendations about how to help those clients make healthier choices and also to help the clinicians to do a better job at making recommendations. And then we will also ask the student to analyze and reflect on their own nutritional health. We'll take a very conservative view there. We won't propose anything radical. Another new course, Outbreak. And this course is a follow-on to the mystery case. In Outbreak, the student plays the role of an epidemiologist working for the National Disease Control Center, a fictional organization. And the student's job is to investigate a potential outbreak of infectious disease. They're doing classic epidemiology. They need to determine what data needs to be collected. They need to organize and analyze that data, generate hypotheses related to the outbreak, and determine what steps are needed to determine the source of the outbreak and contain it. So nothing like this could possibly happen in the real world, right? Yeah, sure. Another new course, sports medic. The student is in the role of an intern exploring a possible career in sports medicine. The student will work through 2 cases involving teenage patients who visit the hospital after sustaining sports-related injuries. In the first case, the student will observe and critique a physician who is diagnosing and treating that patient. In the second case, the student will reach a diagnosis and propose a treatment for a patient, him or herself. Also, the student will be asked to provide some science-based information to people and organizations outside the hospital on sports-related issues. And something a little different, we put it in because it's an interesting course and it's kind of a near neighbor of health sciences coming out of the biological sciences space, is a course called Plant Plague. And in this course, the student plays 2 roles as a plant pathologist. First of all, they're working for a rural farming agency in Kansas, and they'll identify a mysterious fungus in wheat fields and recommend what action local farmers can take to deal with the fungus. It might range from application of very heavy duty pesticides to just letting the infection run its course. The students will make an evidence-based decision and recommendation on that. Then the student is asked to join the United Nations Food and Agricultural Organization. And the UN has a UN 99 task force. UN 99 is a wheat rust, and it poses a major threat to the world's food supply. They will need to analyze a range of proposals for dealing with U99 wheat rust and recommend the best course of action to the United Nations. Okay, I think what I'll do now, if it's okay, is I'll demo the mystery case course. I'm kind of set up to demo that. And since it was our most popular case in the spring, I thought it might be a good one to demo here. So again, the student is playing the role of a resident at the Riverside Memorial Medical Center, working under the supervision of a fictional physician, Dr. Sophia Campbell. There's another question. Yes, the people in these fields the mentors, as we call them, do have experience. They are not physicians, I will hasten to add, but they certainly are experienced and knowledgeable in these domains. And it was the case when we ran these courses previously. We've run them here. We've also run them elsewhere. That it has been a very good, very well received learning experience for the students. So we call these rotations because they're not a traditional course, but they're an immersive learning experience. And we explain to the student what it is that they will do during the rotation, how this course website is organized, how to use it as they work through a course. We give them advice on how to succeed. This is general advice about being proactive, working in teams. We actually do run these courses team-based. They're career exploration. They're meant to be fun. They're meant to be collaborative. So we will run all of these courses as team-based experiences. And students have to learn to manage their time. They need to learn to make principled decisions, exercising good judgment. We have a number of learning resources. We have learning resources that are related to the subject matter, in this case, medical subject matter. We also have general learning resources on things like conducting research, listening effectively, making presentations, project management, note-taking, teamwork, and writing. And these are all carefully curated from the best available sources. Okay, so what's going to happen as they work through the mystery case? The first thing they're going to do is they're going to develop what's called a differential diagnosis based on an examination of the patient conducted by the attending physician, which they will observe. They will look at the signs, symptoms, and hypothesize potential causes for them. Then they'll ask for test results. They'll interpret those test results. They will feed the information gained into that differential, as it's called, that set of possible causes, and kind of whittle it down and possibly even add some new possible causes to it. They'll do another round of test results, and from that, they would be able to make, hopefully, a definitive final diagnosis. Then a twist happens in the case, and I'm not going to reveal what it is because it's an interesting part of the learning experience. They'll develop a discharge summary, and they'll reflect on the learning experience. Okay, the attending physician, Sophia Campbell, welcomes them to their new role. Their patient is Ella Cruz, and she came to the emergency room for treatment. She's 9 years old, and it seems to be a serious case. And the attending physician is going to interview Ella and do some initial physical examination. The student, as the student observes this, the student will begin building a differential diagnosis. And to help structure this, we've given the student a differential diagnosis form. And you can see that here, it was possible diagnoses. What are the symptoms that Ella experienced that they've observed, the signs, the symptoms that suggest these possible diagnoses? Is there any evidence against these diagnoses? What tests would be conclusive for ruling a diagnosis in or out? And is the diagnosis still under consideration or has it been ruled out? Okay, let's meet Ella, shall we?
Hi, good morning. I'm Dr. Campbell. Hi, I'm Nina Cruz. This is my daughter, Ella. Hi, Ella. Now, what seems to be the problem?
Well, she's been a little bit out of it since she woke up. I'm a little worried. That's why I called her doctor, and he told me to come in right away.
Okay, well, I'm glad that you're here. Can you give me a little bit more of an idea of what's going on with Ella?
Well, Ella's had the flu for about a week or so.
Okay.
She's had a little fever and has been home from school. I thought she was feeling better, but this morning she woke up awfully sleepy and she just hasn't been herself. She's complaining about stiffness in her neck and I don't know. I just thought it could be a sign of something serious.
Well, we'll see. How old are you, Ella? How old are you, Ella?
Oh, you talking to me?
Are you having trouble hearing me?
I guess so. I can hear you now.
Okay. I'm going to do a little.
Okay, so anyway, you get the idea. It's a very in-depth, long interview and examination process. And you can see Ella has a hearing issue. You can also consult Dr. Campbell's notes on the examination. And then your job is to do that differential diagnosis. So how do you do it? I mean, you're not a doctor. Well, we have resources to help you. In particular, we have something called the Diagnosis and Treatment Archive. And what it does is it allows you to go from clinical findings to possible diagnoses that could be causing them, and to go in the opposite direction from diagnoses to signs and symptoms. So we come in here, we look at it, signs and symptoms, hearing loss, and here are some possible causes. I mean, some are not very serious. Some are actually quite serious. It will also exhibit some confusion. What's the possible cause there? So here's some possible causes here. And you can see some overlap between the possible cause of confusion, the possible cause of hearing loss. So that might be suggestive, but we don't have the evidence to make a diagnosis yet. We're going to need to do some tests to do that. So other information available to students, we have an in-depth introduction to the diagnosis and treatment process. We have material on neurological examinations and on physical examinations. And something that perhaps I should mention, because I guess, Helen, you were interested in the material. We developed this with a grant from the Kauffman Foundation, and they have a goal of making education more effective. And this was a demonstration project that they sponsored a few years ago. So here is something called a project roadmap. And what it does, it takes students systematically through the process. So they'll meet with their team. They'll review the material from Dr. Campbell. You look at the differential diagnosis form, watch the interview video, perhaps watch it again. Watching it more than once would be helpful. Review Ella's chart. And then using the diagnosis and treatment archive, they'll research every clinical finding they saw during the interview and examination, make a prioritized list. And we'll talk about how to prioritize diagnoses, because there are a variety of ways to do it. There are things ranging from serious symptoms that must be treated to just a priori probabilities. I mean, one of the jokes in medicine is if you hear hoofbeats, it's likely to be horses, not zebras. So students will learn to factor all of these things in the prioritization process. They determine appropriate tests. I mean, and this, again, they can refer to this to see which tests are likely to be definitive, recommend them. Then they review their work and they submit their differential diagnosis form to their mentor. Their mentor will give them feedback. This will be team-based. So the team will submit one form, and after doing that, the mentor will look at it, see is anything missing? Are the diagnoses, possible diagnoses, completely supported by evidence of signs and symptoms? What have they missed? How can they improve things? The mentor will either say, well, this is good, go on, or say, you ought to look more carefully at these aspects of the case and try to improve what you're doing. And then students can't create a fake submission, but I can. and then they go on and they get test results. They get a variety of traditional test results. They also get some x-rays, and they'll use those to factor into the diagnostic process. I think I'll stop there and go back into the discussion of the health sciences program in general. Are there any questions before I do? Okay, a typical session, we meet for 2 hours in the late afternoon, Monday through Friday, and the session depends on what students are doing. I'll get to your question in a sec. If they are, watching the video and coming up with a possible differential, they will do that working as a group with the mentor observing, facilitating if necessary, and giving some just-in-time feedback. We do expect the student to do a little bit of reading on their own, especially things they're interested in, but there's not a tremendous requirement for a whole lot of work outside of the course itself, because this is intended to be a career exploration. They are intended to learn, but it's also intended to be fun. So we really don't want to make this like traditional school, but the process will be rigorous, and they will have to do good work and arrive at the right answer eventually. Okay, so this is really open to any student who's interested in exploring careers in health or biological sciences. And students do need a desktop or laptop computer with a high-speed internet connection. We will be doing all of the work in Zoom. And so it's just a lot more pleasant if you have a high-speed connection, because we would like to use video in these group meetings so people can get to know each other virtually. Here are all the courses listed again. You can see when each course starts and ends. You can see when it meets, the days of the week it meets, and you can see the tuition. And you can see that we've scheduled 2 sessions each of forensic investigation and medical mystery case, because those were very popular in the spring, and we expect a lot of students to be interested in the summer. So we want to be able to accommodate students. So again, there's no need to write this down, because we'll be glad to send you a copy of the presentation and also to send you a recording of this session. So if you have questions about the content of the program or about how it's taught, please contact me. If you have administrative questions, you can contact Sandy Montrose, who's the program manager for the high school programs, or V, who's the program coordinator. So, I mean, we've answered some questions so far, but do you have additional questions? Glad to answer any questions you have now, or if questions occur to you, you can feel free to email them to any of us, and we'll be glad to answer any questions you have. You're welcome, Helen. Thank you for attending. Thank you all for attending. We really appreciate you giving us some of your late afternoon, early evening for this information session. Hopefully, one or more of these courses seems interesting to you, and we'll see you enrolled in the summer or perhaps in the fall.
I did have a question, Ray. I just wanted to ask, how if I missed a few days of my course, or I was sick one day and couldn't attend, what would I do?
Well, the mentor will work with a student individually to help them catch up if necessary. If a student were to have an extended absence, so for example, this is a 1-week course, so if you missed a day, we could help you catch up. If you miss more than that, you might be at a significant disadvantage. In a longer course, there might be a little more flexibility. And certainly if courses fall across holidays, we do take a few days off around the holiday, like the 4th of July holiday. So Roger, there are no prerequisites for any of the courses I just described, except mystery case is a prerequisite for Outbreak, because as you might suspect, the Outbreak might be related to mystery case in some way. But it's really students who are just interested in exploring these careers and who are willing to do the work and have a a reasonable computer with a high-speed internet connection. We have had students as young as 15 and students, up to seniors in high school. So it really does work well for a pretty broad age range. And the mentor can work with students individually to tailor it and give them the best experience that we can. So how many students in each course? The largest enrollment we had in the spring, I believe, was 15. We've had other courses with 12, and we do ask for a minimum enrollment of 5 because we do want students to work together to collaborate. And if we do have a large course, like we have 12 or 15, what we probably do is for parts of each mentoring session, we'd use Zoom breakout rooms and break the students into smaller groups to work together. So every student is actively participating and students aren't, in some sense, what I used to call hiding in a group. Okay, are there more questions? Well, I'll tell you what, if you have any additional questions, please email me, email Sandy Montrose, or email V. We'll be glad to answer any questions you have. And thank you again for spending some time with us this evening.
Yes, thank you all for coming. Like I said in the chat, we are planning fall courses, and those should be updated on our website by Friday or Monday at the latest to give you all some more options for scheduling. Thank you, and look forward to my email with this info session, as well as if you want to provide any feedback, that would be the email to reply to.
Good. Have a great evening, everyone. And one question that I do have for you is some of the courses are a little longer than others. Are the longer courses okay, or do you think, say, for example, a 3 or 4 week course is too long? We could certainly tailor the courses if they're too long, if that was by popular demand, but that's a piece of feedback I'd really appreciate. So thanks again, everyone. Have a great evening.
Thank you all.
Okay, thanks, V.